You're listening to the Applied Natural Medicine podcast, showing how the science of naturopathic, integrative, and functional medicine is applied by clinicians in real-world practice. This is a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005.
Hello, everyone. I'm Dr. Kareem Kendi, the new medical director of Naturopathic Doctor News and Review. I'd like to welcome you to our roundtable series dealing with our latest May NDNR issue, which is focused on mental health and insomnia. And within that issue, there was a number of interesting articles and key themes that came up, and one of which is the use of psychedelics in psychedelic-assisted psychotherapy. Before we get in to discuss this a little bit further, I'd like to give a brief introduction to myself. I'm Dr. Kareem Kendi. I completed my conventional medical training at Ross University School of Medicine on the nature island of the Caribbean in lovely Dominica, West Indies. That's where I really first developed my love of natural medicine. After completing my doctorate, I found out there was this thing called naturopathic medicine, and everything from its philosophy, therapeutic order, and naturopathic physician oath were a calling to me that I needed to answer. And so I pursued my naturopathic doctorate at National University Health Sciences, spent some time in the hemp CBD industry, in the general supplement industry, as well as doing private practice. And with that, I would like to welcome our other panelists. Dr. Natasha McLay, please introduce yourself.
Hi, everyone. Pleasure to be speaking to all of you today. I'm the medical editor at NDNR, and I'm currently practicing in San Diego, California. I have my own clinic, and in terms of my naturopathic background, natural medicine's been a passion of mine since a young age. I was blessed to be raised by a family who adopted a lot of these therapies early on. I had grandparents who were herbalists and really saw the benefit of all these natural therapeutics right away. Naturopathic medical school was something I rushed to as soon as I got the opportunity. Fast forward, I'm really excited to be a part of NDNR and just see all the amazing advancements that naturopathic doctors are doing across the globe for patients, expanding our practice, and really just pushing the bounds of what medicine can accomplish. NDNR is definitely a place you want to be tuning into so that you know what's coming up in medicine and how you can adopt that into your practice.
Thank you so much, Natasha. Dr. Node Smith needs no introduction, but an introduction he will give us nonetheless. Please, Node.
Thanks, Kareem. Thank you, Natasha. I'm so happy that NDNR has been resurrected this past year, and I'm extremely excited about these new roundtable recorded discussions that we're going to start doing on the case studies represented in each issue. There's been a lot of exciting things happening behind the scenes with NDNR, including our new continuing education platform, which has rolled out the last month or so, which some of you might be aware of. We're really, really happy to give our readers, give the doctors, our colleagues, continuing education for the reading that you're already doing. You love reading NDNR, you're getting a ton out of it. There's no reason why you shouldn't be rewarded by the continuing education that you are getting. I am Node Smith, and I've been acting as the continuing education director and associate editor and jack of all trades for NDNR for almost 10 years now. I'm working with Razi and Matt and various staff members over the years. And I am a naturopathic doctor. I practice in Saskatchewan, Canada. For all of you who don't know where that is, it's right above North Dakota. It's cold. And I have a very specialty practice. I concentrate on conscious development. I work mainly with individuals who have been to therapy and counseling before and are really struggling with not being pushed into areas of discomfort, doing shadow work, that type of deep dive, mental, emotional, introspective work that is sometimes very elusive for people to tackle, but we often feel a pull to it nonetheless. So in light of this issue, I would say that most of the work I do is psychedelic therapy without a psychedelic agent. So we might get into talking a little bit about what that means. But thank you so much. I'm glad to be here.
Again, thank you. And if I'm not mistaken, you authored a book recently, The Witness and the Four Behaviors, a
Oh,
kind and honest guide to the art of self-healing.
I did. Yeah. So that is my mentor, Charlie Cropley, who's a naturopathic doctor in Boulder, Colorado. He's been my mentor for, I don't know, 15 years or so, since my first or second year in school. And essentially, that is a summary and synthesis of the work that he has facilitated my understanding of and my my interpretation of that in my own clinical practice.
Excellent. Be a great resource for all the fledgling naturopathic doctors. Now, wanted to jump right into it. Psychedelic assisted psychotherapy, say that 5 times fast, is definitely a burgeoning field in medicine in general. We're seeing a change slowly in certain areas of the legal landscape, but more importantly, in the cultural landscape surrounding the use of psychedelics, these powerful psychoactive substances, some that can be more dissociative, some that can be more hallucinogenic, and each kind of having their own unique sort of signature impact, pharmacotherapeutic aspect to them. But regardless, whether we're talking about psilocybin, which is a very key discussion point, a substance that again is naturally occurring, has been used by many different indigenous cultures for eons. Likewise, a number of different plant medicines that have this effect, but obviously, even modern synthetic pharmaceuticals can have their place in this discussion of using psychedelics to assist patients for psychiatric and psychological issues, be that depression, anxiety, PTSD, or various kinds of traumas. Now, you brought up a very fascinating point on psychedelic therapy without the psychedelic. And I've heard similar types of, I guess, similes as for people who focus on the counseling aspect, dealing with some of that trauma shadow work. Dr. Moshe Block talking about homeopathy without the actual homeopathic remedy. So one thing that I think, regardless of how you look at it from a conventional or a naturopathic standpoint, is irrelevant. There's no denying that the synergy of the appropriate counseling plays a critical role in outcomes. On its own, psychotherapy of various forms can be effective in mitigating depression and other psychiatric illness. The same can be said about pharmaceuticals. However, that combination in pretty much every trial is synergistically going to be superior to either intervention alone. And I think that brings to the forefront an important consideration when it comes to psychedelics, because like any sort of therapeutic, there can be a dark side to it as well. And this can especially be the case when people who do not have the appropriate training medically, therapeutically, are using undisclosed amounts of unknown substances in some of the sketchiest kind of environments that will not be conducive to that healing process. So
100%.
can you take us a little bit through the importance of laying the groundwork before we even get into psychedelic assisted therapy?
Yeah, absolutely. So I think first there's a couple terms that are being utilized within the psychedelic therapeutic space right now and have been for the last 60 years, 70 years. And two of those are set and setting. Okay. So this is probably terms that you've heard before, but it's really important that we start using these terms when we're talking about these things, because it's exactly what you're talking about. Set is that foundation, right? So anyone who is familiar with how psychedelics work, it's like getting dropped off into the jungle and you show up with all of the ego scaffolding and understanding that you have. Just because other people have talked to you and relay their experiences of 100% oneness and universal connectivity with the universe, that doesn't mean that your understanding and that your psyche is going to open up to give you that exact same experience. There may be elements of that are universal. Ineffability, the inability to really describe the vastness of what we experience during a psychedelic experience or journey. That's more of a universal similarity that most people describe, but the meaning behind that or the significance of that can differ dramatically. And it differs partly based on our set, what we're going into that therapeutic experience with, the training, the understanding of what is actually happening, what to expect, how to navigate the twists and turns of what our own mind, what our own ego defenses, what our own history, what our own stories, all of those things that come forward. So set is incredibly important, and that's what we're talking about when we're referring to preparation. Okay, the counseling that is occurring before someone actually takes a agent. You know, what type of therapeutic process leads up to that, helps someone build the scaffolding to understanding, what am I expecting? What is this? What are the intentions behind this? Who am I without the psychedelic? What are the things? How do I rationalize and understand my history and my trauma? To what degree do I have self-agency in this process? Am I taking this psychedelic to simply fix something that maybe can't be fixed in the first place? And that hinges on a secondary aspect of set, which is intention. What is the intention behind this? And you mentioned that as well, that there are instances where psychedelics are not therapeutic at all, that they're being utilized recreationally, which is neither here nor there, but it's not therapeutic. And there's fuzzy gray areas. Is every single person who's embarking on a ceremonial psychedelic journey with ayahuasca in the jungle having a therapeutic experience? Probably not. I come from an AA, NA, 12-step recovery background, and I know firsthand that there's tons of addicts who do psychedelics and they do them in ceremonial instances and try to convince themselves that it's healing and whatever, and they may be getting healing, but they're also doing so out of an addictive drive. And I've talked to numerous people on both sides before getting into recovery, after being in recovery, individuals who have been in recovery and have experienced incredible benefits from psychotherapy or psychedelic-assisted therapy, ayahuasca. And so it's not as cut and dry as we want it to be. It's very individual, but the preparation is required. It's mandatory in order to have a effective therapeutic response, or else we're just interpreting that experience through a very uninformed map, uninformed template.
Now, before we talk a bit more about that preparation, the set, what you're bringing to the table, can you just briefly differentiate that from the setting, which is taking place in the
Yeah,
therapeutic
absolutely.
house?
Yeah, so the setting is the place in which you are participating in a psychedelic therapy. And so the setting can be drastically different. In a ceremonial context, might be a group of people, it might be outside, it might be facilitated by multiple or just one facilitator. It might be a doctor facilitating an assisted psychotherapy session, or it might be a shaman, medicine man. It might be in a foreign country. Hallmarks of an appropriate setting are settings that are safe, right? Now that means drastically different things for different people. For one person, participating in a therapy like this in a situation where they're around other people might be absolutely horrific. And at the same time, it might be horrific for another person to do it alone, just depending on what our set is, what our history with community, what our history with ourselves is, what our history with doctors, what our history with religion is. Another element of setting is that we want it to be clean, inviting, friendly. We want it to be neutral or informed by the patient or the client. And what I mean by that is if we have a agnostic individual who has negative connotations with religion, we don't want a bunch of Catholic icons and things in our treatment room. Likewise, if we have a very staunch Christian individual, we probably don't want a ton of things that might reflect more magic elements of things that could be interpreted as spiritism, things like that. They likely get enough of that during the experience. They don't need to have those conflicts going into it.
Definitely. I think that aspect of neutrality, safety, a more conservative approach, and even a lot of times certain degree of sensory deprivation is oftentimes using blindfolds for some people. So that at least they're not getting that additional kind of stimulus, and maybe they're focusing more on the auditory stimulus, be that natural sounds, just calm discussion and reassurance through that process.
And
go ahead, please. Yeah, I'd like to hear your.
Yeah, to elaborate on that further, the setting also extends to what your home life is, waiting for you. Work life is going to. I've had patients go through these experiences, and I always preface, give yourself as much time as you can pre and post to integrate. This is something that your body's going to be in flux. You just changed a lot of neurotransmitters, a lot of things going on physiologically. Do not go back to work the next day.
100%.
Schedule some time to be in the space that you need to, have that comfort of your home, have conversations with your loved ones, your friends. You likely may not be ready to talk about the things that came up. You might want to wait for that professional to have those conversations, or you might want that support. So just really setting the tone pre and post is going to make that experience so much easier. And again, just improve the outcomes on all fronts.
100%. Yeah. And this is an area where and the preparation via counseling and different psychoanalytic tools help people understand the rationale behind integration. It's commonly said not to talk with anybody about your experience on a psychedelic for between 24 and 48 hours. And the reason for that is that our ego selves, our scaffolding as human beings, we really want to project this idea that other people understand us and that we're correct and accurate, that my experience is essentially the same experience that you're having. And when I say that out loud, it sounds like, no, that's retarded. That's ridiculous. Like nobody, but it's almost universal. We want to feel that that other people understand us. And so you have this profound experience that is, like I said, I use that word ineffable. It's indescribable. And then you go and try to describe it to someone. You try to describe the indescribable to someone. And most people don't even have a language to begin to start unpacking that. This is the language of mystics and gurus and this is the language that we fight and have wars about from religious spiritual wisdom texts, right? So you're trying to use that language to describe something that's brand new to you. And a lot of people get really frustrated and annoyed and confused. And then it can easily turn back to shame, guilt, judgment on this experience not being real. And so it does really require a certain amount of understanding of what personal experience is and how to hold one's personal experience and not give it away to other people too soon.
That's that's an excellent point. Delaying sharing that experience, because again, part of oftentimes what gets people to that place in the first place where they find they may benefit from such a level of therapy is again some of that subconscious programming, which again comes from that external environment. And whether it's finding the I am, the actual self beneath the layers of ego, which are a part of who you are in reality, but it doesn't, there's something beyond the essence that goes beyond words. That becomes again very much reality, experiential, and something that requires self-reflection, and something that I think that again, people who may just chase the psychedelic kind of biochemical experience
Yeah.
without working on something that both of you brought up, the integration, the taking of that experience, the taking of, the goals, the mindsets that you are working towards, and the counseling you've been doing before and through that to make, the meaningful gains in your overall outlook in mental health. So I'd love to just hear both of your thoughts on the integration aspect briefly.
Go for it, Natasha.
Yeah, I can't agree more how important integration is, and the prep for the patients that I've supported through these experiences, not directly with the ketamine itself. It's been really important to have the certain tools such as breath work in place so that when you're in that experience, you have something to lean on, to feel grounded by, and even a meditation practice, whatever it is for that patient, something to have a slight sense of control, something to come back to makes all the difference. Beyond that, I've seen reflections and integrations post experience. For some individuals, it really clicks into place a week beyond this experience. For others, it's something they're thinking about for months on end. So, really laying those expectations that psychedelics do very deep work. What comes up, you may not understand right away, and that's okay. This is where journaling can be particularly helpful to really remember the experience, because you can forget these pieces quite quickly, but you can always come back to it. You can always recontinue the conversation. And I've seen some pretty amazing breakthroughs in terms of depression, autoimmune conditions. The list just goes on. If for anyone who's interested in these types of experiences, it's just so important to set yourself up for success and ask all the questions that might come to mind. And from the clinician standpoint, make sure that they're doing their justice on a health standpoint, pre and post as well. This goes beyond just the talking and the mental emotional work. If you can, be on the right nutrition, the supplements, make sure you're taking the right diet. Depending on the psychedelic, the diet you do beforehand is incredibly crucial and can vastly change your experience. So these are all minute but very important details that a lot of individuals who are just looking for that lay experience don't realize. Beyond that, going off of referrals from other clinicians is so crucial. Going with people that you trust. There are so many individuals, especially in different countries, doing these psychedelic experiences, and they can be incredibly profound and beautiful. But absolutely, you need to establish that safety and have all the supports on hand to make sure this experience goes off well.
Thank you, Dr. McLay. That was
Yeah.
wonderful. And I think that I'm going to throw out a pitch from the continuing education side here. One of the learning gaps and learning objectives that we're trying to emphasize within the continuing education platform is how to integrate therapies, pharmaceutical therapies or therapies from other types of medicines, so pharmaceuticals or psychedelic therapy definitely fall into that category, into naturopathic practice. So how does a naturopathic doctor approach and utilize these tools or agents in a very specific and particular way because of the informed training that we have as naturopathic doctors? Because we're taking some of these agents, we're taking out of a more Cartesian kind of external silver bullet, take this pill and get fixed paradigm or perspective, and putting it into a perspective that does require a lot more self-agency, a lot more responsibility and accountability and preparation that goes beyond the immediate therapeutic sessions. And what I mean by that is we're talking about preparation in terms of counseling primarily, but then Natasha, you just mentioned the diets and the sleep and the breath work. And these are all things that naturopathic doctors are teaching their patients regardless of whether they're using psychedelic therapy or not. But they're elements that are incredibly important to include in the standard of care for delivering these types of psychedelic therapies. Yeah, if you're writing articles on psychedelic-assisted therapy, don't forget to include your naturopathic modalities and how you're synergistically utilizing those. What the question was, integration, Kareem. So, I find that most patients who I work with have some type of sense that there is an obstacle in front of them, that they can sense that there's another side to life, there's another side to their experience that they just cannot get to. Often it's visualized as a door, a locked door, a brick wall, a boulder that they can't move. Something is standing in their way, but they know that there's another side to it. And something I talk about with a lot of my clients, a lot of my patients, especially individuals who've been to counseling, been to therapy before, and are pretty high functioning, is our thoughts and the way that we think about reality is inherently what is creating our experience inside that reality. It cannot be any other way. What I believe is what manifests in my life. And if you can't take that at face value, just try to think about something that you don't know. Just try to go to the Rolodex in your mind and find something that you don't know, that you don't understand. And it's very difficult. You can't. A psychedelic, just any or a lot of novel experiences has the potential of unlocking that door to things that we have never seen before, and just giving us such a new perspective that we can all of a sudden approach things that may have been, I would say, quote, concretely understood, that we've really thought we understood to the limit of its understanding with a beginner's mind. And so when people come to me after psychedelic therapy, or they've had psychedelic experiences, and we're working on difficulties in their life, communication elements, or career advancement, or stress, anxiety, and burnout, I start to find, I try to help people see what is the different thing that you experienced in this psychedelic journey. So what's the different thing that you weren't able to experience before, that was totally new? And how is that informing a new potential to understand something. Because that's what changes our scaffolding, right? It's what changes our internal structure of understanding reality. So to me, that's what integration is about, is taking these incredibly novel experiences that we had in a psychedelic journey or some other type of journey. Somebody goes on a 4-day wilderness vision quest, and they're going to have experiences that are drastically different and novel than what they experience every day. Their relationship with themselves, their relationship with the earth, what matters, what doesn't matter, all becomes on it. It is introduced onto kind of the table or the palette that someone paints their life with in a new way. And all of a sudden, it's more malleable to make sense of their relationships with other people, their relationships with themselves. And my experience is allowing somebody to talk those things through, interact with those things, and just be super, super curious about it. What is happening with that person? What's happening with that individual's understanding of themselves? It usually ends up being quite profound.
I think hit on a lot of phenomenal points today in terms of, first of all, just having a consistency and understanding in the language between the set of what the patient brings and the adequate preparation that's to be taking place, as well as the setting in which you are doing this, the importance of those naturopathic, foundational principles of health, because there is no denying that both the experience and the recovery integration period afterwards are going to be drastically impacted by the foundational nutrition, sleep, breath work, and then ultimately going back to the importance of mindset and why these are such a powerful tool, because of that capacity to be able to disrupt these sort of negative feedback loops and patterns to allow an openness. And I think this comes down to the fundamental aspect of what makes naturopathic medicine and this approach so profound, is the aspect of hope. And in that environment of being able to shift away from negative pattern thinking, but you've done the prep work in advance, realizing that you have an understanding that there can be a better future. And by hoping for that better future, by visualizing that better future, you help to actually make that a reality. And so I think, again, this is how all these different layers come together. We can definitely talk about p-values and statistical significance of a study, but ultimately it really is all of these layers that go into the complete individual that can impact and potentially lead to lasting change benefits in that patient. So with that, I'd like to just give you an opportunity to offer some closing remarks before we conclude today's webinar. Dr. Natasha, please share your thoughts with us.
Yes, so this is just a very exciting field of medicine. I'm really looking forward to seeing how doctors integrate this into their practices, and particularly how naturopathic medicine can take that lead. In terms of all the medical professions out there, I do think we are one of the most equipped medical professions to take on this role and have the delicacy and heart to really see a patient through beginning and end and make sure that they're going to not only be okay, but get the best out of this experience possible. And of course, just make sure they're safe throughout the process. I think you're really going to enjoy the articles coming out on this topic and learning more about Dr. Watters' experience. He is definitely a wealth of knowledge, and I love the history that he paints on ketamine specifically. So there's a lot of exciting information to come, and can't wait to see what all submissions come up next from inspiring this talk.
So much, Natasha. No, please.
I guess I would end with the comment that I think there's an inclination to consider psychedelic therapies as the next panacea or silver bullet, because it is so powerful. And those of us who have had our own psychedelic experiences often like to think that the power of our own experiences is the universal experience. And I think we would all be well served considering or asking the question, what patient is not a good candidate for psychedelic-assisted therapy beyond simply those who have a schizophrenic history or bipolar 2 history, but are there individuals who maybe need more psychological understanding of themselves before something like this would be beneficial? And are there certain types of patients who don't respond well, who are more likely to have negative experiences and then interpret those negative experiences as negative, not valuable, not growth producing in any type of way, but are potentially even traumatizing to them? I know that Erica Zimmelfan talks a lot about this, that difficult experiences are one thing and bad experiences are another thing. So I think we owe it to ourselves, we owe it to our patients to consider where the limitations are of these therapies, because none of these things are perfect. There's no silver bullets. We know that.
Absolutely. Again, always use your clinical judgment, use your own intuition. I think sometimes you'll have an idea if someone is not the appropriate recipient of a targeted therapy that may have a phenomenal track record in your own clinical experience. It is, again, we are dealing with the individual, and some things don't require a power hammer. Some things will do just fine with some very delicate fine tuning, and that's really what's needed in that individual. So again, I want to thank both of you for sharing your clinical wisdom and insights, and remind everyone tuning in to check in ndnr.com for our updated continuing education courses. Plenty of opportunities there, and we look forward to continuing these conversations with you.
Awesome. Wonderful. Thank you too.
Thank
Thank you.
This has been the Applied Natural Medicine Podcast, a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005. Access the full archive of case reports and clinical insights at ndnr.com. For subscriptions, partnerships, or submissions, contact us at editor@ndnr.com.